Today I'll be discussing electrical stimulation in beds as a dysphagia treatment. Neuromuscular electrical stimulation has been one of the emerging treatments for post-stroke dysphagia. People with dysphagia have difficulty swallowing liquids, foods, or even saliva. Aspiration pneumonia, dehydration, and malnutrition induced by dysphagia not only cause psychological shock to patients, but may contribute to prolonged hospitalizations, increased medical costs, and even death. Approved by the Food and Drug Administration in 2001, electrical stimulation is a non-invasive external treatment of dysphagia that involves placing electrodes in the oropharyngeal musculature. How does it work? NMES has a theoretical dual mode of action, motor and sensory. It stimulates local muscle contraction and/or activates muscle-related sensory pathways. Stimulates muscle contraction by stimulating the neuromuscular system with electrodes that depolarize both the oropharyngeal musculature and sensory axons, so a signal is sent to the CNS. With repetition, the CNS can control this movement on its own. Simultaneously, it stimulates sensory feedback to enhance brain plasticity by stimulating sensory afferents from deep branches involving cranial nerve 9 and cranial nerve 10. Once evaluated by the SLT, the patient begins treatment while feeding practice and strategies are performed in combination. Electrical stimulation is provided daily in hourly sessions with a dual-channel electrotherapy system with a current and a fixed pulse rate and duration. SLTs adjust the phase duration of the current to improve tolerance and minimize fatigue for some patients. Electrode placement is based on clinical signs and symptoms. For example, signs of anterior spillage, pocketing, and nasal regurgitation would possibly lead to electrode placement over the buccal branch of the facial nerve to target oropharyngeal swing muscles and to increase sensory input over cranial nerves 5 and cranial nerve 7. To administer this treatment, you must have professional theoretical knowledge and must have additional training to become certified. Sometimes it can cause discomfort to the patient's larynx. This will impact the intensity of the treatment and should be monitored throughout. Although initially considered controversial since identified as an area needing further evidence-based research, there's now a growing consensus on its benefit in the treatment of dysphagia. Stimulation leads to less rehospitalizations when combined with traditional therapy, swallow response biomechanics and neural sensory pathways improve, and it reduces the need for thickening fluid to maintain a safe swallow, thus contributing to an improved quality of life. In summary, electrical stimulation provides great outcomes for patients with dysphagia when combined with traditional dysphagia therapy.
Created using Powtoon.